Ghaith Prometric Exam Question and Answer, Part 7. Which of the following could adversely affect the function of pacemaker? A. Hair dryer. B. Electric razor. C. Television. D. Electric mixer. The answer is D. Electric mixer. Does electricity affect a pacemaker? Yes, human exposure to external 50 to 60 Hz electric and magnetic fields induces electric fields within the body. These induced fields can cause interference with implanted pacemaker. Other appliances that contain a magnet include handheld hair dryers, older shavers with an electrical cords, large stereo speakers, electric toothbrush, and base chargers of electrosonic toothbrushes. If you do use any of this, keep them 16 centimeters or 6 inches away from your pacemaker. The nurse provides discharge instruction to a client after implantation of a permanent pacemaker. The nurse should tell the client to avoid exposure to which item? A. Hair dryers. B. Electric blankets. C. Electric toothbrushes. D. Airport metal detectors. The answer is D. Airport metal detectors. A 58-year-old man had a permanent pacemaker inserted. The device is in place and functioning well. The skin at the incision site is intact and free of infection. The nurse gives him the discharge instruction. What is the most important nursing care outcome? A. Understand functioning and operating of pacemaker. B. Monitor pulse rate and identify need for reporting. C. Able to identify the signs of detached pacemaker. D. Modify lifestyle and wear pacemaker alert sign. The answer is D. Modify lifestyle and wear pacemaker alert sign. A 9-year-old girl is seen in the emergency department because of fracture in the right fibula. Which of the following is the expected response to parent question about bone healing period of the girl? A. 4 to 6 weeks. B. 2 to 4 weeks. C. 6 to 8 weeks. D. 8 to 10 weeks. The answer is B. 2 to 4 weeks. During the reparative stage, over the next few weeks, the soft callus becomes harder. By about 2 to 6 weeks, this hard callus is strong enough for the body part to be used. The repairing or reparative phase begins within the first few days after the bone fracture and lasts for about 2 to 3 weeks. During this time, the body develops cartilage and tissues in and around the fracture site. A 13 weeks pregnant multigravida woman is anxious and apprehensive. She has 5 children and is not willing to continue with the pregnancy. She is requesting the midwife to abort the fetus. She is underweight, malnourished, and is overworked. The BMI is 17 kg. What intervention is desired immediately? A. Admission and intravenous line management for induction. B. Family planning and birth control measures. C. Dietary management and supplements. D. Support, reassurance, and counseling. The answer is D. Support, reassurance, and counseling. Which of the following is the most appropriate action for a nurse manager starting at a new hospital? A. Observe staff while keeping presence and role unknown. B. Plan and coordinate new strategies with top-level management. C. Introduce self and observe unit activities for at least 3 months. D. Meet with each staff member separately about needed unit changes. The answer is B. Plan and coordinate new strategies with top-level management. A nurse explained to a patient that an endoscopy tube will be inserted down the throat during a gastroscopy, which will cause gagging, but it must be swallowed. What type of communication the endoscopy nurse was used here? A. Assertive. B. Interactive. C. Formative. D. Informative. The answer is A. Assertive. Assertive communication is all about stating your needs clearly but respectfully. By being assertive, you let others know where you stand while also acknowledging their position. You can become more assertive by being honest, avoiding judgment, and focusing on your feelings. While informative communication focuses on helping the audience understand a topic, issue, or technique more clearly, informative communications range from brief emails to formal written reports to digital or in-person presentation to training about a new process or system. While the interactive model of communication refers to the back-and-forth communication process that is seen in basic conversations, a source sends out a message to a receiver who then responds to the message with a reply. A nurse who works in the surgical unit at one of the hospital was asked by the home healthcare nurse to make a home visit to a patient with colostomy who had been discharged on previous day in order to give him a follow-up care and education. Which of the following nurses should do the assigned task? A. Critical care nurse. B. Psychiatric nurse. C. Surgical nurse. D. Community nurse. The answer is D. Community nurse. When is the ideal time to administer analgesia to a woman in labor? A. As soon as she requests analgesia. B. When labor is well established. C. When the woman enters into transition phase. D. When the woman progresses from latent to active phase. The answer is D. When the woman progresses from latent to active phase. A 46-year-old patient is admitted in the female medical ward for a severe back pain, which is graded 6 on the scale of 10. Her vital signs are to take with the slight elevation in her blood pressure. The patient was refused to eat lunch, which is a low sodium diet. The attending nurse has documented that patient is uncooperative and has refused to eat the lunch. What nursing intervention needs attention first? A. Arrange for alternative diet. B. Teach importance of the low-salt diet. C. Take appropriate measures to relieve pain. D. Inform the physician for elevated blood pressure. The answer is C. Take appropriate measures to relieve pain. A 30-year-old man was brought to the hospital by ambulance, falling from a height of 10 meters. He was mechanically ventilated and after a Glasgow coma score showed a level of 6. The nurse is observed for any changes in perceptual, sensory, or cognitive. Which of the following is an expected patient's response at this time? A. Slowly obeys commands. B. Exhibits no motor response. C. Reacts towards painful stimuli. D. Uses incomprehensible words. The answer is C. Reacts towards painful stimuli. A 46-year-old woman is admitted in the medical ward for systemic lupus erythematosus, complaining of joint pain with dull, aching pain in the number of region. She has butterfly rashes on her face. Which of the following should be the first nursing intervention for this patient? A. Skincare and cortisone ointment as ordered. B. Pain-relieving measures and physiotherapy. C. Assess back pain and monitor urine output. D. Analgesics as ordered, warm environment. The answer is B. Pain-relieving measures and physiotherapy. A 75-year-old patient was bedridden for the last 1 year. She was incontinent, restless, delirious, and was trying to pull her nasogastric tube out, but her arms were restrained. Her forearms had bruises and her lips were dry and cracked. The blood pressure is 100/64, heart rate 102, respiratory of 28, the temperature of 39.2. Which of the following nursing intervention each nasogastric feed? A. Pull to check the tube in place. B. Check the tube for patency. C. Aspirate the content. D. Insert water. The answer is C. Aspirate the content. A 45-year-old man was admitted to the surgical ward after removal of pancreatic cyst. The registered nurse checked the post-operative orders. Ondansetron PRN was prescribed for the patient. Which of the following complaints from the patient will require the registered nurse to serve the ondansetron after 12 hours of post-operative period? A. Wound pain. B. Nausea and vomiting. C. Congestion of phlegm. D. Difficulty in passing urine. The answer is B. Nausea and vomiting. Ondansetron is used to prevent nausea and vomiting that is caused by cancer medications or chemotherapy or radiation therapy. A man nurse is caring for a woman diagnosed with major depression. The client states, "I never had a male nurse before." Which of the following is the most appropriate nursing response? A. Do you feel threatened? B. Most of the nurses here are males. C. How do you feel having a male nurse? D. Do you want me to find a female nurse? The answer is C. How do you feel having a male nurse? Which of the following statements best describes for patients with myopia? A. They must hold a paper at arm's length or greater to read it. B. They can see close-up objects clearly, but distant objects are out of focus. C. They can see distant objects clearly, but close-up objects are out of focus. D. They are unable to focus horizontal and vertical rays of lights on the retina simultaneously. The answer is B. They can see close-up objects clearly, but distant objects are out of focus. Myopia or nearsightedness is common vision condition in which close objects looks clear but far objects looks blurry. The medical term for nearsightedness is myopia. Myopia happens when the shape of the eye or the shape of the certain parts of your eye causes light rays to bend or refract. Which of the following tests measures the total quantity of prothrombin in the blood and monitors the effectiveness of warfarin sodium or coumadin therapy and prolonged deficiencies in the extrinsic factor? A. Thrombin time. B. Prothrombin time. C. Partial prothrombin time. D. Activated partial prothrombin time. The answer is B. Prothrombin time. Why is prothrombin time used to monitor coumadin therapy? The prothrombin time PT is a test that helps evaluate your ability to appropriately form blood clots. The International Normalized Ratio or INR is a calculation based on the results of a PT or prothrombin time that is used to monitor individuals who are being treated with a blood-thinning medications or anticoagulant like warfarin, coumadin. A 72-year-old patient presents to the medical clinic drooling with a blank stare, mask-like facial expression, and a high-pitched, monotone, weak voice. When walking, the patient does not swing the arms normally, but holds them stiffly rigid. What is the most likely diagnosis? A. Parkinson's disease. B. Substance abuse. C. Traumatic brain injury. D. Transient ischemic attack. The answer is A. Parkinson's disease. A person with Parkinson's disease is with a brain disorder that causes unintended or uncontrollable movements such as shaking, stiffness, and difficulty with balance and coordination. The symptoms usually begin gradually and worsen over time. As the disease progresses, people may have difficulty walking and talking. They may also have mental and behavioral changes, sleep problems, depression, memory difficulties, and fatigue. Other symptoms of Parkinson's disease are tremors in hands, arms, legs, jaw, or head, muscle stiffness where muscle remains contracted for a long time, slowness of movement, and impaired balance and coordination, sometimes leading to falls. A 69-year-old obese woman with a pelvic fracture has been immobile for 4 days. The patient is now anxious, dyspneic, and demanding of substernal pain. The patient's capillary refill is greater than 3 seconds. The heart rate is 122, respiratory rate is 26, temperature is 38. Which of the following the nurse suspects for this patient? A. Panic attack. B. Pulmonary embolism. C. Aspiration pneumonia. D. Pneumothorax. The answer is B. Pulmonary embolism. Before preparing a client for the first surgical case of the day, a part-time scrub nurse asks the circulating nurse if a 3-minute surgical hand scrub is adequate preparation for this client. Which response should the circulating nurse provide? A. Inform the nurse that hand scrub should be 3 minutes between cases. B. Direct the nurse to continue the surgical hand scrub for 5 minutes duration. C. Validate that the nurse is implementing the OR policy for a surgical hand scrub. D. Ask the experienced nurse to perform this scrub since it is the first day of the nurse. The answer is B. Direct the nurse to continue the surgical hand scrub for 5 minutes duration. An infection control nurse is responsible to conduct the surveillance and how the hospital staff take precautionary measures against flu. Based on her findings, she is responsible to conduct the awareness, raising the doctors and nurses in the inpatient areas. Which of the following is the goal for the nursing practice here? A. Infection control management. B. Research and survey. C. Primary prevention. D. Health education. The answer is C. Primary prevention. A 57-year-old man is admitted to the cardiac unit with palpitation, headache, and chest tightness. On auscultation with S3 gallop, and murmur can be heard. The blood pressure is 90/60, heart rate is 170, respiratory rate is 25, temperature is 37. What is the ECG rhythm of this patient? A. Atrial fibrillation. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Supraventricular tachycardia. The answer is D. Supraventricular tachycardia. The answer is D. Supraventricular tachycardia. If you have supraventricular tachycardia, you'll usually feel your heart racing in your chest or throat. The heart rate is usually between 140 to 180 beats per minute but can also be high as 250. A normal heartbeat for an adult should be 60 to 100 beats per minute at rest. The SVT or supraventricular tachycardia has a narrow QRS complex. Which of the following is the main disadvantages of home care visit? A. Time-consuming for healthcare team. B. Inexpensive than hospital care. C. Easy access to equipments or consultation. D. Nurses have more control or mother's distraction. The answer is A. Time-consuming for healthcare team. The patient has nausea and vomiting and muscle weakness, comes to ER. After assessment, the doctor considered that signs and symptoms is due to A. Hypokalemia. B. Hypernatremia. C. Hyperkalemia. D. Hypoglycemia. The answer is A. Hypokalemia. Patient has heart failure and suddenly has edema. What is the lung sound we'll be hearing? A. Rels. B. Ronchi. C. Wheezing. The answer is A. Rels. The lung sounds are heard with heart failure is the appearance of pulmonary crackles or rales, defined as discontinuous, interrupted, explosive respiratory sound during inspiration, is one of the most important signs of heart failure deterioration. Why crackles in heart failure? The crackles is a fluid in large airways causes crackles early in inspiration and congestive heart failure. Crackles that tend to be a bit lower in pitch than the early, higher pitch is fine. Crackles are associated with fluid in small airways like pneumonia. The physician has written an order for the nurse assignee have a 24-hour urine collection sent to the laboratory for special test. Which of the following should the nurse realize prior to urine? A. Start the urine collection at either 12 a.m. or 12 p.m. B. Provide enough sterile receptacles for the urine collection. C. At the start of the collection period, have the patient discard the first urine. D. Inform the patient that they must save all urine for 24 hours beginning at 12 a.m. The answer is C. At the start of the collection period, have the patient discard the first urine. After bee sting, which of the white blood cells is the most likely elevated? A. Eosinophils. B. Basophils. C. Monocytes. D. Neutrophils. The answer is B. Basophils. Disadvantage of democratic leader cannot be used in emergency situation. Question: post-operative breathing exercise importance. A. Prevent atelectasis. B. Move secretions. The answer is A. Prevent atelectasis. The quality nurse manager teaches a new nurse graduate about the comparison between total quality assurance and quality improvement. What is the most appropriate statement regarding the common aspects between QA and QI? A. Aim to improve quality. B. Focus on preventing errors. C. Focus on staff development. D. View nursing activities as major tasks. The answer is A. Aim to improve quality. The client has atrial fibrillation. The nurse should monitor the client for A. Cardiac arrest. B. Cerebrovascular accident. C. Heart block. D. Ventricular fibrillation. The answer is B. Cerebrovascular accident. Azithromycin is prescribed for an adolescent female who have pneumonia and recurrent chlamydia. What information is most important for the nurse to provide? A. Use 2 forms of contraception while taking this drug. B. Have partners screen for human immunodeficiency. C. Decrease intake of high-fat foods, caffeine, and alcohol. D. Report a sudden onset of arthralgia to the healthcare provider. The answer is A. Use 2 forms of contraception while taking this drug. General knowledge. Postpartum or puerperal infection is any clinical infection of the genital canal that occurs within 28 days after miscarriage, induced abortion, or childbirth. The definition used in the United States continues to be the presence of fever of 38 degrees Celsius or higher or 2 successive days of the first 10 postpartum days, starting 24 hours after birth. Isoniazid for TB, side effects, numbness, hepatitis symptoms, stomach upset, and rashes. Neck rigidity, nerve stiffness, the signs of meningitis. Haemophilus influenza type B vaccine is for meningitis. Nerve cause tooth pain, fifth nerve or trigeminal nerve. Hypoglossal nerve, 12th cranial nerve for innervates tongue muscle. MI, ST elevation, ischemia, ST depression. Pulse deficit is the difference between apical beats and brachial pulse. The common cause of death in school age is accidents. Serotonin, example, Alzheimer's. Dopamine, example, schizophrenia. Question. When a patient was first diagnosed with schizophrenia, one of his family members asked the nurse about the possible causes. The nurse said that one reason is that he may have had an excess secretion of a neurotransmitter. Which of the following neurotransmitter? A. Serotonin. B. Dopamine. C. Glutamate. D. Endorphins. The answer is B. Dopamine. A patient has low platelet, low hemoglobin, and low WBC. A. Prevent bleeding. B. Check vital signs. C. Reverse isolation. The answer is C. Reverse isolation. A child has diarrhea 7 times and he is irritable and lost his skin turgor. What is the degree of dehydration? A. Mild. B. Moderate. C. Severe. D. Extensive. The answer is B. Moderate. The answer is B. Mushy feces. The appearance of stool in transverse colostomy, put out firm or paste-like stool at infrequent intervals, but most of them move often and put out soft or loose or oatmeal-like stool. It is important to know that the stool contains digestive enzymes, chemicals made by the body to break down food. A baby boy birth weight is 3 kg. What is the expected weight at the age of 1 year? A. 7, B. 9, C. 11, D. 13. The answer is B. 9. The average baby weight at 1 year. Most babies double their birth weight by 4 to 6 months of age, and they triple it before the first birthday. By 1 year, the average weight of a baby girl is approximately 19 pounds, 10 ounces, or 8.9 kg, with boys weighing about 21 pounds, 3 ounces, or 9.6 kg. Gastric suction can cause A. Metabolic acidosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Respiratory alkalosis. The answer is C. Metabolic alkalosis. Oral iron supplements are prescribed for child with iron deficiency anemia. The nurse instructs the mother to administer the iron with which food? A. Orange juice. B. Apple juice. C. Milk. D. Water. The answer is A. Orange juice. The patient is scheduled for a total hip arthroplasty. The nurse reviews the chart and notes the following: serum potassium of 2.8 MEq per liter, AB positive blood type, and elevated ST segment electrocardiogram. Which of the following would be the most appropriate action to do next? A. Report abnormal or diagnostic results to the surgeon. B. Review the patient's consent for the surgical procedure. C. Educate the patient on the risk factors and side effects of surgery. D. Ensure that the patient has post-surgery physical therapy. The answer is A. Report abnormal diagnostic results to the surgeon. A cardiac care unit nurse decides to gather relevant data of myocardial infarction patient who has breathing difficulty, bradycardia. Which is the best kind of databases relevant to this situation for the nurse? A. Focus database. B. Complete database. C. Emergency database. D. Follow-up database. The answer is C. Emergency database. A nurse cares for a client with an epidural catheter for labor pain management and requests additional medication. A student-registered nurse anesthetist or SRNA responds and administers medication via the epidural catheter. Which action performed by the SRNA requires the nurse to stop administration of medication? A. Aspirating blood fluid into a syringe. B. Obtaining a negative aspiration into a syringe. C. Cleansing the port with alcohol for 15 seconds. D. Assessing the client's blood pressure. The answer is C. Cleansing the port with alcohol for 15 seconds. Patient with osteoporosis, what is the best exercise he should practice? A. Walking. B. Bowling. The answer is A. Walking. The patient feeling hand numbness, which medication should he receive? A. Vitamin C. B. Vitamin K. C. Vitamin 12. D. Folic acid. The answer is C. B12. Post-limb amputation pain. A. Phantom. B. Radiating. C. Shooting. The answer is A. Phantom. Phantom pain is when you feel pain in a body part that you no longer have. Most commonly, it involves limbs that are no longer there. This is specifically known as phantom limb pain. A co-worker informs the nurse about experiencing increased level of stress associated with daily responsibilities to help cope with professional stress. The nurse should encourage the co-workers to A. Make a list of unfinished tasks. B. Complete complex mental tasks before physical tasks. C. Acknowledge daily accomplishment. D. Spend time with colleague away from work. The answer is A. Make a list of unfinished tasks. Beneficence refers to actions that promote the well-being of others. The nurse who is exemplifying beneficence takes positive actions to help clients. After testicle removal, the client should avoid heavy lifting. Question. According to Ramsey sedation scale, patient in ICU on sedation on assessment, patient deep sleep and not responding to light. What is the score? A. 2. B. 3. C. 4. D. 6. The answer is D. 6. In Ramsey's sedation level, score 1, patient is anxious and agitated or restless or both. Score 2, patient is cooperative, oriented, and tranquil. Score 3, patient is responded to commands only. Score 4, patient exhibits brisk response to light, glabellular tap, or loud auditory stimulus. Score 5, patient exhibits a sluggish response to light, glabellular tap, or loud auditory stimulus. For score 6, patient exhibits no response. After rectal surgery, what bath type? Sitz bath. Question. A mother came to ER with child diagnosed with rheumatic fever. The nurse should ask the mother if there is a family member has A. Congenital heart disease, B. Recently have tonsillitis. The answer is B. Recently have tonsillitis. A 45 years old with severe upper GI bleeding is admitted to the medical ward. The doctor orders the nurse to give the patient's blood transfusion. Which peripheral IV catheter gauge is best for this procedure? A. 14 gauge, B. 16 gauge, C. 20 gauge, D. 24 gauge. The answer is B. 16 gauge. A nurse is caring for a client who is having an allergic reaction, febrile, flush. What is the first nursing action? A. Stop blood transfusion immediately. B. Replace the blood with saline. C. Administer an antihistamine. D. Place the client flat with the feet elevated. The answer is A. Stop blood transfusion immediately. The nurse is monitoring a client receiving a blood transfusion. After 30 minutes, when the clients develop a cough with shortness of breath. The client also complains of a headache and a racing heart. What should the nurse do first? A. Stop transfusion immediately. B. Replace the blood with saline. C. Administer an antihistamine. D. Slow the infusion rate. The answer is D. Slow the infusion rate. Important notes. If reaction happened within the first 15 minutes, stop blood transfusion immediately. If the reaction happened after 15 minutes, slow infusion rate first, that cause of overload, then inform the physician. During the patient's blood transfusion, which of the following are associated with an allergic reactions? The nurse should recognize that A. Diarrhea, rapid onset of chills. B. Itching and asthmatic wheezing. C. Low back pain and acute renal failure. D. Distended neck veins and a rise in venous pressure. The answer is B. Itching and asthmatic wheezing. A nurse is assigned to care for a 32-year-old glomerulonephritis. The nurse is transcribing patient's file. Which of the following orders should the nurse to clarify? A. Bed rest. B. Daily weight. C. Strict intake and output check. D. Frequent blood pressure check. The answer is A. Bed rest. When is the best time to collect urine specimen for routine urinalysis and culture and sensitivity? A. Early morning. B. Later afternoon. C. Midnight. D. Before breakfast. The answer is A. Early morning. The nurse is assigned to care for a patient with Paget's disease, complaining of bone pain. Which of the following conditions in this patient high risk for? A. Hypomagnesemia. B. Hypernatremia. C. Hypercalcemia. D. Hyperkalemia. The answer is C. Hypercalcemia. People with Paget's disease often develop kidney stones and or calcium deposits in blood vessels and heart valves. These problems are caused by increased calcium in the body from the faster than normal breakdown of bone tissue. A mother came to ER with a baby with rheumatic fever. The nurse should ask the mother about A. If there is any member family has congenital heart disease. B. If he recently had tonsillitis. The answer is B. If he recently had tonsillitis. Young patient arrived in ER with burn in his left arm and his weight is 48 kg. How to calculate fluid requirements for the patient according to Parkland formula? A. 1,572 ml. B. 1,220 ml. C. 1,728 ml. D. 2,000 ml. The Parkland formula is as follows. Total crystalloid fluid, a solution with small molecules that can move into the cell over the first 24 hours, equals 4 ml, which is the constant, times percentage of total body surface area, times body weight. A 75-year-old man is scheduled to undergo fecal emulsification surgery. The nurse meets with the family for a preoperative. The patient has a diagnosis of Alzheimer's disease with memory decline. The family says that he has become increasingly anxious and that his emotions are unstable. Which of the following actions the patient is expected to do operation? A. Lay supine for 20 minutes. B. Sit without moving under laser. C. Consistently speak clearly. D. Tolerate general anesthesia. The answer is D. Tolerate general anesthesia. A nurse admits a client sent from the healthcare provider's office. The nurse calls the provider to obtain prescriptions. Which action should the nurse take? A. Hold treatments until the provider signs the prescription received. B. Read each prescriptions back to the provider prior to the ending the call. C. Have the provider provide the prescription to another nurse as well. D. Verify the prescription with the charge nurse before beginning the treatment. The answer is B. Read each prescription back to the provider prior to ending the call. The ABG reading was low pH, high PCO2, normal bicarbonate. What is the interpretation? A. Compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic acidosis. D. Metabolic alkalosis. The answer is B. Uncompensated respiratory acidosis. 3 years old has returned to the clinic after 4 days of being diagnosed with gastroenteritis and dehydration. A parent reports that the vomiting has stopped and the child is tolerating liquids, rice, applesauce, and bananas. The diarrhea persists but seems to be decreasing in volume. When evaluating the signs of dehydration, the nurse will assess the patient's skin turgor by A. Grasping the skin over the abdomen with 2 fingers and raising the skin with 2 fingers. B. Grasping the skin over the forehead with 2 fingers and raising the skin with 2 fingers. C. Holding the patient's mouth open and assessing the tongue for deep creases or furrows. D. Drawing 2 tubes of blood and running blood urea nitrogen, BUN, and creatinine. The answer is A. Grasping the skin over the abdomen with 2 fingers and raising the skin with 2 fingers. To decrease the anxiety of a 10-year-old girl who is undergoing surgery, which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is A. Use a heart model to show her how the surgery will go. An infection control nurse notices purulent exudate, redness, and tenderness of the surgical wound site for a few post-operative patients in a surgical unit. She discussed with the ward nurses and emphasized that wound infection after surgery can be prevented. Which of the following is the best possible action to minimize the incidence of wound infection? A. Perform assessment pain on the wound site. B. Wash hands before and after patient's activity. C. Encourage adequate intake and early ambulation. D. Support incision appropriately and avoidance of straining. The answer is B. Wash hands before and after each patient's activity. A nurse is giving health education regarding the management of premenstrual syndrome symptoms to a group of first-year nursing students. Which of the following information regarding the diet will the nurse include in the presentation? A. Take 3 healthy meals a day to prevent hypoglycemia and increase feeling of well-being. B. Include simple sugars in the diet to prevent low blood glucose levels which cause mood swings. C. Drink 2,000 ml of water, coffee or tea per day to flush the kidneys and improve fluid retention. D. Decrease intake of caffeine such as coffee and chocolates to minimize irritability, insomnia, and anxiety. The answer is D. Decrease intake of caffeine such as coffee and chocolate to minimize irritability, insomnia, and anxiety. General knowledge. Hepatitis C complications include liver cirrhosis, liver cancer, liver failure. A diabetic mellitus patient had left low knee amputation. The nurse in the surgical unit has been doing wound care for 3 days. The nurse evaluated the wound's condition to review the care plan. Which sign shows poor glucose control in wound healing? A. Swelling of the stump. B. Bleeding of the stump. C. mild redness of the wound site. D. Separation of the wound edges. The answer is D. Separation of the wound edges. When examining the tympanic membrane of adult by otoscope, the nurse should move the adult pinna in which direction? A. Down and forward. B. Up and backward. C. Up and forward. D. Down and backward. The answer is B. Up and backward. When examining the tympanic membrane of infant by otoscope, the nurse should move the infant pinna in which direction? A. Down and forward. B. Up and backward. C. Up and forward. D. Down and backward. The answer is D. Down and backward. A client has just returned to a nursing unit after an above-knee amputation of the right leg. The nurse should place the patient in which position? A. Prone. B. Reverse Trendelenburg's. C. Supine with the amputated limb flat on the bed. D. Supine with the amputated limb supported with pillows. The answer is D. Supine with amputated limb supported with pillows. A patient with ongoing blood transfusion and the nurse observed the patient has difficulty to breathe and shivering. What is the nursing priority? A. Stop infusion. B. Call the physician. C. Slow rate of infusion. D. Give intravenous fluid. The answer is A. Stop infusion. A 70-year-old man is brought to the emergency department on wheelchair. He complains of drowsiness, fatigue, lack of appetite for the past 3 days. With history taking, the patient stated that he did not eliminate since 5 days and he is not ambulating a lot. Because of this, arthritis of both knees developed. Why is constipation one of the common problems for immobilized patients? A. Decreased peristalsis. B. Increased colon motility. C. An increased defecation reflex. D. Decreased tightening of the anal sphincter. The answer is A. Decreased peristalsis. General knowledge. Tympanocentesis is a minor surgical procedure that refers to puncture of the tympanic membrane with a small gauge of needle in order to aspirate fluid from the middle ear. Otitis media surgery is myringotomy. Suspect patient with H1N1. What is the highest priority nursing action? A. Isolate the patient in private negative pressure. B. Take nasopharyngeal swab. The answer is A. Isolate the patient with private negative pressure room. What is MAP? MAP is a mean arterial pressure. The definition is average pressure in a patient's arteries during one cardiac cycle. How to get the mean arterial pressure or MAP? Diastolic blood pressure times 2 plus systolic blood pressure divided by 3. For example, the diastolic is 87 times 2 plus 120 divided by 3. So 294 divided by 3 is 98 mmHg MAP. A 30 years old married man presents to the clinic with complaints of feeling sad for the past 3 months. He is unable to maintain regular sleep routine. He lost his appetite and has difficulty concentrating. He is prescribed a medication which prevent to reuptake of specific neurotransmitters that could contribute to his mental health problem. Which is the side effects would be the most important for the nurse to advise to the patient? A. Polyuria. B. Photophobia. C. Fluid retention. D. Sexual dysfunction. The answer is D. Sexual dysfunction. A surgical unit nurse assessed a 35 years old post-appendectomy and observed abdominal distension with absence of bowel sounds. Which of the following interventions is most appropriate? A. Encourage ambulation. B. Provide liquid diet as tolerated. C. Ensure patency of nasogastric tube. D. Check surgical site for signs of infection. The answer is A. Encourage ambulation. The nurse assesses a client with ileostomy for possible development of which of the following acid-base imbalance? A. Respiratory acidosis. B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. The answer is B. Metabolic acidosis. Which food considered low potassium diet? A. Bananas. B. Avocado. C. Berries. D. Strawberry. The answer is D, strawberry. Which of the following signs and symptoms is associated with increased intracranial pressure? A. Restlessness and confusion. B. Bradycardia and hypertension. C. Tachycardia and hypotension. D. Respiratory depression and headache. The answer is A. Restlessness and confusion. The nurse anticipates which of the following responses in a client who develops metabolic acidosis. A. Heart rate of 105 beats per minute. B. Urinary output of 15 ml. C. Respiratory rate of 30 cycle per minute. D. Temperature of 39 degrees Celsius. The answer is C. Respiratory rate of 30 cycle per minute. The common signs and symptoms of metabolic acidosis include accelerated heartbeat or tachycardia, confusion or dizziness, feeling very tired or fatigued, loss of appetite, headache, rapid breathing or long deep breathing, nausea and vomiting, and feeling weak. The Code of Professional Conduct is produced and published by A. The Nursing and Midwifery Council. B. The Royal College of Physicians. C. The Royal College of Nursing. D. The Department of Health. The answer is A. The Nursing and Midwifery Council. During a prenatal examination, the nurse draws blood from a young Rh-negative client and explains that an indirect Coombs test will be performed to prevent whether the fetus is at risk. A. Acute hemolytic disease. B. Respiratory distress syndrome. C. Protein metabolic deficiency. D. Pathologic hyperbilirubinemia. The answer is A. Acute hemolytic disease. Coombs test or antiglobulin testing is an immunology laboratory procedure used to detect the presence of antibodies against circulating blood cells, RBCs, in the body, which induce hemolysis. Excess iodine affects which organ? A. Brain. B. Heart. C. Liver. D. Thyroid. The answer is D. Thyroid. A 46-year-old patient is in the male urology ward after the surgical removal of the stone from his left kidney through percutaneous nephrolithotomy under general anesthesia. He reported to the nurse that he has dull acting pain in left lumbar region. His nephrostomy bag is attached through tube in his left kidney for a few days. What findings would alert the nurse to report to the physician immediately? A. Abdominal discomfort and conniption. B. Severe pain and discomfort of surgical site. C. Presence of blood and stone granules in urine. D. Urine output less than the identified amount. The answer is B. Severe pain and discomfort at surgical site. A 6-year-old child was admitted to pediatric medical ward with acute glomerulonephritis. Which of the following is an indication of acute glomerulonephritis? A. Pain in urination. B. Frequent urination. C. Difficulty in urination. D. Pharyngitis 15 days ago. The answer is D. Pharyngitis 15 days ago. Post-streptococcal glomerulonephritis, or GN, is a kidney disorder that occurs after infection with certain strains of Streptococcus bacteria. The most common cause of a sore throat or pharyngitis is a viral infection such as cold or the flu. The sore throat caused by a virus revolves to its own strep throat or streptococcal infection. A cardiac monitor for a patient in coronary care unit shows abnormal ECG rhythm with heart rate of 159 beats, the QRS complex of 0.18 seconds, and absence of P waves. What could be the type of possible dysrhythmia? A. Sinus tachycardia. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Supraventricular tachycardia. The answer is B. Ventricular tachycardia. A 9-year-old child has a fractured femur and full leg cast has been applied. Which of the following is a physiologic effect of immobilization? A. Avenostasis. B. Increased metabolic rate. C. Positive nitrogen balance. D. Increased need for oxygen. The answer is A. Venostasis. A community health nurse screens a group of high-risk adults for tuberculosis. Which gauge needle should the nurse use for the intradermal injection on the volar surface of the forearm? A. 16 gauge needle, B. 20 gauge needle, C. 22 gauge needle, D. 26 gauge needle. The answer is D. 26 gauge needle. The maximum time for suctioning in adults is A. 5 seconds, B. 8 seconds, C. 10 seconds, D. 15 seconds. The answer is C. 10 seconds. A registered nurse in the intensive care unit performed Glasgow scale assessment on a 50-year-old man who sustained head injury 24 hours ago. The recorded Glasgow coma scale was 10. Which of the following actions should be taken immediately by the nurse? A. Inform the registered nurse in charge of the nursing. B. Protect the patient by raising the two side rails. C. Inform operating theater for emergency surgery. D. Perform neurologic assessment every 15 minutes. The answer is B. Protect the patient by raising the two side rails. A 3-week-old newborn is diagnosed with Hirschsprung's disease. Which of the following preoperative care should included in the nursing care plan? A. Restricting oral intake to clear fluids. B. Administering a tap water enema. C. Inserting a gastrostomy tube. D. Using povidone iodine to prepare for perineum. The answer is A. Restricting oral intake to clear fluids. A 10-year-old child has very limited vocabulary and interaction skills. She has an IQ of 45. She is diagnosed to have mental disease retardation of this classification. A. Profound, B. Mild, C. Moderate, D. Severe. The answer is C. Moderate. Which of the following is the best nursing action to ensure safe medication administration? The nurse feels the dosage is unsafe for the patient. A. Call the pharmacy. B. Call the head nurse. C. Contact the prescribing doctor. D. Administer half of the dose. The answer is C. Contact the prescribing doctor. Which of the following considered contraindication of tonsillectomy? A. Child with adenoid infection more than 4 times per year. B. Child with tonsillectomy more than 4 times per year. C. Child age less than 3 years old. D. Child with hypertrophied adenoids. The answer is C. Child age less than 3 years old. A 50-year-old woman post-myocardial infarction was admitted in the medical ward. A nurse was assigned to care for the patient. The blood pressure is 140/80, heart rate is 120, respiratory is 22, temperature 37, and auto saturation of 95. A. Arrhythmias. B. Endocarditis. B. Cardiac failure. D. Cardiogenic shock. The answer is D. Cardiogenic shock. A heart attack is the most common cause of cardiogenic shock. Less often, another heart problem or a problem somewhere else in the body blocks blood flow coming into or out of the heart and leads to cardiogenic shock. In most cases, in myocardial infarction, there's a lack of oxygen to your heart. Usually from a heart attack, damage its main pumping chamber, left ventricle. Without oxygen-rich blood flowing into that area of your heart, the heart muscle can weaken and go into cardiogenic shock. A child has been seizure-free for 2 years. A mother asked the nurse how much longer that the child will need to take the anticonvulsant or seizure medication. A. Medication can be discontinued at this time. B. The medication dosage can be reduced gradually. C. New medication can be ordered after 1 year. D. Medication can be discontinued after 5 years. The answer is B. The medication dosage can be reduced gradually.